Listeners and viewers, you are welcome to the health segment on Darkness TV, right here in the Darkness studio. I am Doe Dogbe, a Senior Public Health Officer Health Promotion at the Volta Regional Health Directorate. This moment, I want us to discuss a very serious topic that we call the silent killer. It is a disease that is killing the youth, especially these days, the working force. And this disease is hypertension. Most of the times when we say hypertension, people think your blood is too much. But that is not it. It is rather when the pressure in your heart to pump the blood to other aspects or other parts of the body is high. It's then that we say you're suffering from hypertension. And this happens when the lumen of your blood vessels are choked. And there are contributing factors to this. It could be a family history or it could be a lifestyle. But what we are seeing these days is more of lifestyle disease. And hypertension is one of the chronic diseases that can lead to stroke or cardiovascular attack, which we call CV, or heart attack that people always say. Now, when we talk about high blood pressure, when your blood pressure, the systolic, which is there, when the blood is pushed to other parts of the body, is above 140. And then when the heart is to relax, but it is above 90, we can say your blood pressure is high. So suppose you have a blood pressure that is 150/100, you are having, or you might be having, hypertension. Suppose you are tested, your blood pressure is checked consistently for a number of times. And when it is checked for a number of times and it is realized that it's still the same or higher than as it should be, then we can say you are suffering from high blood pressure. We know normally the normal high body pressure is supposed to be 90 over or 140/90 or 130/80. But anyone who is suffering from diabetes and the blood pressure is 130/90 is causing an alarm, and that person have to be checked more oftenly so that we prevent the after effect of this hypertension. What are some of the lifestyle that can cause hypertension? Smoking can cause hypertension. Drinking of alcohol can cause hypertension. Late eating can cause hypertension. When you eat and the food does not digest, it is going to pile. And as it is piling, it is going to create what we call the cholesterol. It will increase your cholesterol level, because what will happen is this food that turns to glucose, when it is not used, it is returned back to fat. And when the fat is becoming more, it is going to block your blood vessels. And as it blocks the blood vessels, it's going to make the lumen to be very small. So the way the blood will flow freely through the vessels, it will no more be like that. But we can prevent it. How can we prevent it? We can prevent it by avoiding late eating, avoiding smoking, avoiding lifestyles that will predispose us to this hypertension, such as engaging in drug abuse. If you avoid hard drugs, it will reduce your risk of suffering from hypertension. And more often, one way to be sure you are safe is to regularly check your blood pressure. When you check your blood pressure regularly, you will know whether you are at risk or not. And if you are already detected that you have hypertension, Please make sure you take your medication seriously and go by the instruction given to you by the health professionals. When you do that, you will live long. Thank you very much.